To my immediate right is Kristen Turney, Associate Professor in the Department of Sociology at the University of California, Irvine. Next to her is Breck Donahue, Deputy Associate Administrator, Innovation and Research Division in the Office of Juvenile Justice and Delinquency Prevention in the Department of Justice. Yunmin Yi, a PhD candidate in Sociology and Policy Analysis and Management at Cornell University. And at the far right is Jian Chang, Director of Public Policy at the Casey Family Programs. Both Kristen and Min were co-authors of the paper. Kristen was the author of the paper on children of incarcerated parents, and Min was the co-author on the paper on foster care. So each panelist is going to make a short presentation, and then we're going to have a bit of a Q&A, and then we'll open it back up to the audience. So, Kristen, start with you.
Great, thank you. I also want to start with 3 facts. I didn't see your slides ahead of time. We know 3 key facts about parental incarceration. So first, many children experience the incarceration of a mother or a father. So for example, among children who are born around the turn of the century, in urban areas, about 1/3 of them experience the incarceration of a father, and about 1/10 of them experience the incarceration of a mother by the time they're teenagers. Second, not all children have the same risks of experiencing parental incarceration. So we know that already vulnerable children, such as minority children and poor children, are most likely to experience parental incarceration. And third, we know that by and large, parental incarceration has negative consequences for children's well-being, including their health, their educational outcomes, their behavioral outcomes, and their material hardship and deprivation that they experience. These consequences persist even after taking into account other vulnerabilities that endanger these children, such as family instability and poverty. In the policy brief, John and Ron put forward 3 policy prescriptions that could help children of incarcerated parents. So 1, expanding the use of alternatives to incarceration. 2, making it easier and less traumatic for children to visit their incarcerated parents. And 3, creating school and community-based programs to help these children. So I agree that these 3 policies could go a long way toward reducing the harms experienced by children of incarcerated parents. And in particular, I want to talk a little bit about limiting the use of cash bail as a promising pathway for ameliorating some of the disadvantages experienced by these children. So more than 12 million individuals are admitted to jail each year in the United States, almost always for a short amount of time. 3/5 of individuals incarcerated in jail haven't been convicted of any crime. In my research with more than 120 fathers in Southern California, 120 jailed fathers and their family members, I find that even short-term stays in jail are quite consequential for the fathers themselves and for their children. During interviews with fathers who are in jail, I learned that their time in jail, even for the relatively short amount of time, impedes their economic opportunities. During jail incarceration, fathers have few, if any, opportunities to earn income. And after jail incarceration, fathers have difficulty finding employment. They experience legal financial obligations, the fines and fees that are associated with their case, that can even create a disincentive for employment in the formal labor market. I also learned that the economic consequences of jail incarceration don't end with the consequences for the incarcerated. These consequences extend to their family members, their children, their current and former romantic partners, their mothers, and their siblings, especially their sisters, in part because these men were often contributing economically to their families before their stay in jail, and in part because jail incarceration creates additional expenses. So women in the study who were connected to jailed fathers talked about how jail incarceration was associated with an immediate decrease in their household income. Women in the study also talked about altering their employment patterns in response to the incarceration. So these women are left with parenting and household responsibilities that sometimes force them to leave the formal labor market or to reduce their hours of employment. Third, the women talked about the expenses of maintaining contact with a jailed father. Mothers and romantic partners spend quite a bit of money on care packages, collect calls, and visitation. So we know from other research that reductions in family income following incarceration is a key reason why children of incarcerated parents experience challenges to their well-being. Limiting the use of cash bail would lead to reductions in the number of children who experience parental incarceration, so jail incarceration, which would mean fewer economic consequences for these children and their families, which would go a long way toward improving the lives of these vulnerable children. Reducing cash bail is on the policy agenda in various locales across the United States, and as changes begin to be implemented across counties, it's critical that these and other policy changes are rigorously evaluated. So understanding how these policy changes improve or don't improve the well-being of children, as well as understanding which children are most helped by these policy changes, is really critical for sort of reducing inequality across the life course.
Hi. Well, first my name is Breck Donahue. Again, I'm with the Office of Juvenile Justice and Delinquency Prevention, which is part of the Department of Justice. I want to start by thanking Dr. Lobb and Dr. Haskins for having me here today. I don't get out of the office that much, so it's exciting to be here. I'm retooling on the fly here a little bit about the remarks I want to make, but let me just start by telling you a little bit about my office in case some of you are not familiar with it and what exactly it is we do. OJJDP is charged with providing national leadership, coordination, and resources to prevent and respond to juvenile delinquency and victimization. OJJDP's mission is to support the efforts of states, tribes, and communities to develop and implement effective and equitable juvenile justice systems that enhance public safety, ensure youth are held appropriately accountable to both crime victims and communities, and empower youth to live productive and law-abiding lives. We accomplish these goals by providing direct funding and resources to communities and organizations across the country, as well as providing training and technical assistance to disseminate and promote evidence-based programs and practices. And our office also oversees data collections and research to monitor trends in the juvenile justice system and assist the field in identifying what is and is not effective in preventing and intervening in juvenile delinquency and crime. OJJDP focuses a significant part of our efforts in understanding and addressing the needs of children at high risk of either experiencing or perpetrating crime and violence. And obviously, these two populations of youth we're discussing today are of great concern to our office. We know from research that youth involved in foster care and those who experience the incarceration of a parent are among those most at risk for negative outcomes. And our office administers a number of programs designed to understand and address these risks. I'm going to mention briefly just 3 of the programs that I think are particularly germane to the policy brief that we're talking about today, but we actually do so much work in this area that it was really hard for me to choose, and I was having other ideas popping into my head as I was listening to the presentations today. But I will start by mentioning our mentoring programs. We talked about community-based programs. OJJDP makes about $90 million in mentoring funds available to the nation every year. Obviously, we know that the support of a caring individual in a children's life can have a profound impact on their well-being, and this is particularly true for children who are experiencing family instability. We're focused on funding, though, high-quality evidence-based mentoring. And so to that end, we are doing even more work to try to understand specifically how mentoring can improve the lives of kids in foster care and children of incarcerated parents. And we have a number of ongoing evaluations, multi-site evaluations, that actually are the randomized design, looking to see what kind of impact we can have in those areas. We also do work including Second Chance Act programs that include a mentoring component specifically focused at mothers and fathers returning to the community from their secure confinement. The thing I wanted to mention too, because again, one of the things that sort of popped into my head as we were talking today is thinking about how we're using our courts. I do want to mention that OJJDP provides millions of dollars to support and promote the work of court-appointed special advocates. This funding aids volunteers across the country in ensuring that abused and neglected children have an adult in their lives to ensure that they have high quality representation in dependency courts, that they have access to services they need, and a safe permanent home. But I was also thinking, as folks were talking, about family drug courts. That's another area where we provide significant funding, and we're actually particularly interested in thinking about, with the opioid crisis, whether that is effective intervention and could potentially keep both parents out of the system and getting the appropriate treatment they need, and also keep kids either in the homes or reunify them as soon as possible. And finally, I'll just mention, again, I think John mentioned this at the beginning of the talk, OJJDP believes the key to measuring, monitoring, and evaluating the impact of our efforts is high-quality juvenile justice data. To that end, OJJDP has launched the Juvenile Justice Model Data Project to help states and localities improve the quality and consistency of juvenile justice data and to increase the appropriate use of data in policy and practice decisions at the local, state, and national levels. I think often it's easy for policymakers and the public to see presentations such as Dr. Sampson's today and think all that data is out there and at our fingertips, and it's very easy for local programs to access and for others to access. And the reality is that we have huge issues with juvenile justice data in this country. And so we're trying to think about how we can help move the field as far as thinking about both collecting data, using data, and sharing data. With that, I'm going to stop talking because I only have like 1 minute left, and say that I'm just very excited for the discussion today.
Thank you, Brooke.
Thanks, everyone, for joining us this afternoon, and I want to express my gratitude to Drs. Haskin and Lob for inviting me to be part of this conversation. So again, my name is Youngmin Yi, and I'm in the Department of Sociology at Cornell University, and I just want to take a couple of minutes to talk about the question of whether and how the foster care system might play a role in reducing justice system inequality. So my co-author and I argue that yes, it can, and I'm actually going to take a sociological and demographic approach to talking about this. So why certain systems might work if we put it in the context of the life course and the social systems within which these vulnerable youth operate. So first, as was mentioned earlier, foster care is an experience that is unequally distributed across the child population in the United States. So white children, approximately 5% of them will experience foster care placement at some point by the time they turn 18. But for Black children, that risk is double that. So 10% of Black children will experience foster care placement over that period of their life course. And for Native American children, that prevalence increases to 15%. So this is not a rare experience for children coming from communities that are already marginalized and social groups that are already disproportionately disadvantaged within the context of US social life. Second, the children who end up in foster care are already extremely vulnerable and disadvantaged along a number of dimensions that may or may not have to do with their maltreatment, but may put them at higher risk of maltreatment. And so because of this, they're at a particularly elevated risk of becoming involved in the criminal justice system over the course of their juvenile period as well as adulthood. And so the foster care system, by making contact with these often hard-to-reach populations and families, is actually a very unique policy infrastructure in that it sits at the intersection of this point of contact in which there are viable policy and programmatic levers that can not only prevent children's future maltreatment, but also potentially actively improve their outcomes, with a big part of that being reducing their likelihood of engaging in risky behaviors, as well as getting involved in the criminal justice system later on. And so I just want to point out that by focusing on the foster care system itself, my co-author and I aren't focusing on the earlier stages of the child welfare system at which they're getting reported, screened in, and where maltreatment is being substantiated. So contingent upon the decision already having been made that these children should be removed from the home for their safety, what can we do within the foster care system specifically to improve children's outcomes? So we itemize and go into detail about an array of different interventions at different points of contact within the foster care system that we think might be especially effective in reducing these children's risk of criminal justice contact. But I want to hone in specifically on this one idea of social bonds and the fact that these children, though victimized in some way and disadvantaged, do not exist in vacuums. So they come from social support networks that may take a variety of different heterogeneous forms that may or may not include kin and non-kin, but they also are embedded once they enter the foster care system within hopefully a supportive network that at least can serve as a broker to access to resources. So I'm going to focus on 2 points of the foster care system quickly before I hand the mic over. But first, I'll start at the tail end of the foster care system, so the point at which children are aging out. So this is a vulnerable point in the life course for all youth, really, because this is a point at which there are a lot of changes taking place, and young adults are expected to take on self-sufficiency and responsibility at this point. This also is the point at which, in what is called the age crime curve, and we have some people in the room who have done a lot of work on this issue, this is the point at which adolescents and young adults are at highest risk of engaging in criminal or risky behaviors and getting caught up in the criminal justice system. So even though we know that the transition to adulthood is taking longer for most young adults at this point, we're still expecting our most vulnerable young people to make that transition abruptly at the age of 18 and earlier than the modal young adult. And so one thing we can think about is how the foster care system can adjust to make sure that that demand is not being made of these vulnerable youth and extend foster care beyond the age of 18 so that these youth have access to the full suite of supports and services that were available to them prior. And at the front end of the system, I'll just highlight this idea of heterogeneous forms of social support. So in social groups of color and particularly economically disadvantaged communities, we know that somehow families and communities are making things work. So that may mean that they're drawing upon relationships outside of the nuclear family and extended family to fill in for caregiving responsibilities and socio-emotional and material resources. So one thing that we highlight in our article is that upon itemizing the possible permanency options for foster youth, we may want to encourage people to consider a broader swath of potential caregivers for permanent placements. And this may include individuals such as close neighborhoods or family friends that provided consistent, stable, and loving support or care to children of color or socioeconomically disadvantaged of children or foster youth more generally, but may be ignored in current concurrent planning systems that exist within the foster care system. This would allow us to connect them to the resources available within foster care, but minimally disrupt the social bonds that existed prior and maybe protective effects against higher risks of criminal justice. So these are just a couple of pieces, but in short, the foster care system, there are adjustments that can be made given the overlap in the populations between the foster care system and the criminal justice involved population later in life. And some adjustments that take into account these life course considerations and social systemic considerations may allow foster care, instead of becoming a correlate of criminal justice involvement, as was highlighted earlier, to becoming a point at which it's a disruption in that foster care to prison pipeline. Thank you.
Good afternoon, everyone. Again, my name is Jian Chang, and I'm with Casey Family Programs. I usually tell people before I start talking that I come to this issue wearing multiple hats. I started my professional career as a staff attorney at the Children's Defense Fund, so I've been an advocate on behalf of children in the foster care system. I worked in the policy shop at Casey Family Programs, so I've done philanthropy. I've served in the Children's Bureau, and so I've seen bureaucracy, both good and bad, right? And now I'm back at the foundation. And I think just want to kind of an addendum, I think, to a lot of things that I agree with what Young Min just said about foster care being an important period in which we can help children. I would only say that if children must be in foster care, then we should absolutely make sure that we improve the services and supports we give them to try and break that cycle between foster care, juvenile justice, and the criminal justice system. But my belief is that far too many children are in our foster care system today. But I'm hopeful that with the Family First Prevention Services Act, we are in an unprecedented period where we can, in fact, see a reduction in the number of children in foster care, but perhaps more importantly, an opportunity for us to right so much of the historic inequities that we've seen through this system. So I want to start a little bit by talking about the history of child welfare. We as a country, up until February 9th, 2018, I would say, really only guaranteed funding for one thing, and that's what we ended up seeing a lot of, right? So it was the one intervention that we said was the least desirable, perhaps the most traumatic for children, and that's foster care. We waited until children had serious maltreatment issues, whether it was neglect or abuse. We traumatized kids who may have experienced the trauma of maltreatment further by removing them from the only families and communities, schools that they have known, perhaps separating them from their siblings. We place them at best in family settings. Far too often, we place them in multiple settings. And at worst, we place them in congregate care settings that I argue in many instances are no better than some of the jails and prisons that their uncles and fathers and mothers are in. Now, I talk about a history of child welfare and many other settings, and my argument is that the reason we have this history in child welfare is that our system has been built on centuries of racism, classism, and xenophobia. That has really focused on rescuing children from what we consider to be bad people, right? And placing them in alternative families or institutions instead of treating the underlying poverty, addiction, or mental illness that causes the vulnerabilities and escalates to crisis. Now, under the Family First Prevention Services Act, we have the ability to right that historic wrong because for the first time, Congress is guaranteeing funding not only for foster care, but for prevention and early intervention. Now, that's really exciting, but I do think there are some challenges that the child welfare systems in our country will have to address and overcome if we're going to realize the promise and the excitement of Family First. One is that, as Ron mentioned, these systems are incredibly complex. And one of the things that people love to say about child welfare is that if you've seen one child welfare system, you've seen one child welfare system, right? And although I think that's true in many ways, I argue there are lots of similarities across systems that we have to figure out ways to address. One is that this is a system driven by the public perception that often doesn't understand the work that they do, right? So they drive the narrative, the media often at the front of that about what the system is responsible for, what it defines as success, and the measures of lack of success. And one example that I often talk about is that there is a New England state that for many years had 0 child fatalities as a result of abuse or neglect. They were lauded for the great work, et cetera, et cetera. The first 2 child fatalities a few years ago, in the paper, they were being described as a beleaguered child welfare system. That child welfare director was fired and a new one brought in. And we see this cycle happen over and over again in the system. I think if our systems will be empowered to take advantage of the promise of Family First, they have to stay focused on the task at hand, not try to do everything for everyone, but take on the primary duties of ensuring that children who come to their attention are not abused and neglected again. That if they leave the foster care system, it is to a permanent home and they're not cycling right back in. We have to ensure that no matter what and how good foster care is, it is temporary. It is not a home that any of us would want, a system that any of us would want our children to be raised in, and no child should be raised by a system. But for far too many kids, it becomes their destination and they end up aging out. To me, and I was part of a system that fought to extend foster care to 21. What we have found in some of the studies is that all we do is extend negative outcomes until after 21, right? No child needs to grow up and age out of foster care. That should be a zero-sum game, right? And then finally, I feel like we have to make sure that our workers are prepared, supported, and given access to the services and supports that we know will help our most vulnerable families.
Thank you. Thanks very much. I sent a final draft of the policy brief to a colleague, and she thought it was great, except she felt that the brief did not pay enough attention to the role of poverty, which you mentioned, cash bail, and also the brief failed to talk about the insufficiencies of the safety net. And if you could think about poverty as a driver of incarceration, particularly with respect to low-skilled individuals from poor neighborhoods, child welfare, a huge chunk of the system is made up of neglect, issues about housing, issues with respect to access quality child care, which also could be linked to neglect. And I guess the question for the panelists, are there ideas that we could move to action that could reduce poverty that would indirectly then help vulnerable children, either children of incarcerated parents or children in foster care? You could be silent, we could just go to all of them. Go ahead and ask harder questions.
Can I start?
Sure.
So I mainly actually want to look a little bit to the past or recent or current policies in place that have provided some hope. And I agree with the critique that, at least in my chapter, that we weren't able to fully engage the question of whether there's an adequate safety net to work in collaboration with the child welfare system. And I think your points about stresses and demands on the child welfare system itself are well taken. Thinking about the child not being in a vacuum, these policy systems don't exist in vacuums as well. And so if we're looking to connect foster youth to housing services, employment, transitions into higher education, that is not available to us if there isn't an infrastructure outside in the mainstream society that is available to these youth. But a couple of things that seem to help are, for example, extending Medicaid access or access to youth up to the age of 26. So that's one piece of the economic insecurity puzzle that gets addressed if disadvantaged youth have access to care within the purview of the foster care system or attached to a primary caregiver. And another piece that I'll point to is some work that's been done by other demographers looking at correlates of increases in foster care caseload during the 20th century or the last several decades. And some of that was tied to maternal incarceration. Some of that was also tied to stringent work requirements in the 1996 welfare reform, right? So that if you hit the parents with stringent, for single mothers in particular, with stringent requirements to cash assistance, and that's eating away a little bit more at their ability to provide quality care for their children, then there sets up a scenario for neglect. And so I think that's not a hopeful point, but I'm more speaking to the fact that if we think about the ways in which these policy levers do affect the caregiving environment or scenario for the most vulnerable children, but also their family systems, then I think there are some extensions and smaller tweaks that have seemed politically reachable in the past that we could turn to for some ideas.
So I have one idea that I think a couple of folks have talked about the opioid epidemic, and I think we can't separate the issues of poverty and the impacts in our families with race and inequality. Ron showed the chart that had a huge spike in the foster care numbers in the late 80s and early 90s. We believe that was driven primarily by the crack cocaine epidemic. What's interesting is you look at the last couple of years and you see a very moderate increase in the number of foster care cases, and most child welfare leaders will tell you if they have an increase, it's primarily due to the opioid epidemic. What we see are two drastically different reactions to similar patterns of behavior by parents, right? Crack cocaine epidemic, you remove children, place them into foster care, often for life, and then we wonder why they have bad life outcomes. And the opioid epidemic, we have seen a different response by Congress, by legislators, by the press, and the public in general, much more how do we provide services, how do we intervene. I think that's a good change, but we can't ignore the privilege that allowed a primarily white, middle-class, upper-class suburban phenomenon to receive a very different result. And I think we have to use that privilege to try and make sure that our approach to serving families and meeting their needs, whether it's drug counseling, intervention, and services, is not limited to just this opioid epidemic because it happens to impact this family, right? I mean, 40 to 80% of kids who come into foster care come in because their parent has a drug or alcohol problem. We have to make sure that services are available to all families regardless of income. And so I think that is a poverty and race equity issue that we have to address.
Any other thoughts, or should we go to my next question? So just a fundamental question. Do we have a good estimate of the degree of overlap between kids in foster care and kids, you mentioned maternal incarceration. Do we know the answer to that question? Whether or not what the degree of overlap is?
Between parental incarceration and foster
children
care placements?
and children in foster care.
I don't know of one off the top of my head, but I have to say even the estimates of like the foster care to prison pipeline have really relied on local agencies' estimates or a specific set of states. So for example, that figure earlier looking at how among youth aging out of care, about half are ending up incarcerated in their early adulthood. That's actually from the Midwest study, which is a survey of looking at foster youth within 3 states in the Midwest. So I think population level estimates are actually things that we're still getting our hands on, at least on the child welfare side. And actually know off the top of my head how much overlap has been estimated yet in the agency estimates.
Want to address that?
Yeah, so there is some population level estimates out there, and I don't know the number off the top of my head either. But certainly there's a correlation, and certainly that and it goes both ways, right? So I think the important thing to keep in mind, and this is sort of getting back to the keynote, is that these are really issues of compounded disadvantage, and so we know that children who are in foster care compared to kids who aren't placed in foster care are more likely to have experienced the incarceration of a mother or a father. And conversely, we also know that children who've experienced parental incarceration are going to be more likely to be placed in foster care. I think the trick is sort of disentangling sort of which comes first. And I don't even know, there's a lot of researchers, really, including myself, really like to focus on sort of these causal things, which comes first. Does parental incarceration cause these negative outcomes, or are these negative outcomes caused by other things? And that's almost we all do it. I do it, but it's a kind of a fruitless exercise because the real world sort of happens. These things are happening together.
Well, I was glad to hear Breck mention data, because I think it would be really interesting to take Sampson's map of the first map of the imprisonment concentrations and look at then the children of incarceration, spatial concentration, children in foster care, and see how they stack up. And maybe that's something you could bring back to your administrator.
Well, there's huge measurement issues. I mean, we right now, I don't want to take us off track, but we have been doing some work around looking at the overlap between kids and juvenile justice system and child welfare. And even there, you've got huge measurement issues when you start to, again, it's the pathways issue too, because when you start to think about, are you talking about kids who, concurrent involvement? Are you talking about, starting in one system, moving to the other? And then when you start to broaden the scope of the lens of the time period you're looking at, you start to realize that you can make some assumptions. Oh, this was a juvenile justice kid who ended up in child welfare. Well, actually, no, if you go back. So all that to say, data's hard. And I think people make these assumptions about how, it's all out there, but everybody's collecting data all the time, but actually using it in a way that actually helps drive policy decisions and even just helps programs figure out if they're effective. I mean, it's a really, it's a big hurdle.
And one last question. You mentioned the negative consequences for children of incarcerated parents, negative consequences being in foster care. Are there any differences by gender? Or is it equally bad for boys and girls in both systems? Or both effects, I guess is the best.
So I can start. So there is some evidence, so sort of the best evidence out there does suggest that, at least with respect to paternal incarceration, so the incarceration of a father, it seems that there's sort of emerging consistent evidence that the consequences are stronger for boys. And so that boys sort of losing a father to incarceration is more consequential than it is for girls. And there's been a few fairly rigorous studies that have shown that.
With regards to,
I was just going to say that's consistent with broader literature on family instability as well, that sort of suggests that sort of boys are sort of more affected by things like divorce or separation of parents.
So with the foster care system, my understanding with population level estimates is that there aren't really gender differences with regards to the prevalence of, or the risk of being involved in the foster care system. But if we think about the types of abuse and neglect and maltreatment that take place, those are highly gendered. So sexual abuse is more prevalent among girls. In terms of the consequences of system involvement in foster care placement, I believe that girls seem to be faring worse, if particularly among those who are aging out of care.
Okay. Should we start with your question, if you could repeat it for us?
Sure.
You want to wait for the mic, or? Yes. Go ahead.
I can tell that later. I just wanted to ask, if the goal is reducing the number of kids in care, given what we've been talking about today in terms of the effects not only of family poverty and family problems, but also community-wide problems, how do we go about reducing the number of kids in care, given that it seems to be there are often not many other adults in the community who might be capable of taking care of these kids, given they're also involved in the criminal justice system, but also given how few of the programs that health issues seem to be effective. And I just wonder whether any of you might address that.
Well, I'm glad Ron's coming back for this, the evidence-based expert. I mean, I'll be honest, there's no evidence to say foster care is an effective intervention, and yet we use it with great regularity for this population. I think that, yes, there's absolutely a shortage of evidence-based programs that we have available to date that show that we can prevent these families from coming into the system. However, we have not consistently funded those programs either. I think that is why Family First is really an exciting piece of legislation, because if you don't have a reliable source of funding, it's very hard to either create, install, or spread evidence-based practices. But I think the challenge and the question you raise, I think, is a good one, in that why aren't we spreading even the few things that we do know work, right? The California Clearinghouse that Ron mentioned, there are a handful, but there are a handful and they're not often replicated, right? So I think we do have to figure out what the challenge is with child welfare agencies and taking what we know works, but then understanding, to John's point, under what circumstances do they work and how do we spread them? I think that's the challenge that child welfare agencies have faced. Casey's been working with the 27 jurisdictions that have Title 4E waivers, where they have been tasked with implementing evidence-based programs, and it's a struggle. And I think the challenge is that when you have a system that is under such heightened scrutiny, where there is almost, or what it feels like, zero tolerance for mistakes, the process of installing evidence-based programs requires risk-taking, right? It requires a tolerance for things not working and then trying something out. That's really hard to do in the child welfare system. And then finally, I would say I don't know that it's, and perhaps Robert's data suggests otherwise, but I don't think we have an insufficient number of relatives or community members to take care of our children. We know that millions of kids stay out of the foster care system today because their relative caregivers step up and take care of them outside of the system entirely. And I think the challenge is, how do we locate them? They may not be in the same neighborhood as the child, but they probably exist somewhere in that network. And how do we support them so that they can stay engaged and provide the support to the child?
John, can I add something just real quickly there? First of all, I agree with everything you said, and it's an extremely important point, and the audience probably doesn't follow this stuff. So this is really a crucial moment. And not only everything you said, but the states that do this are required to follow evidence-based policy. So if they do that and use these very programs that you're talking about, and they're required to evaluate, so they have to evaluate to show what they're doing. If they do what they're supposed to, and what this really means is if HHS aggressively implements this program and monitors it and makes sure the states do what they're supposed to do, we could have some real successes. We will have a number of states that will do a good job and will have some successes, and that's the way you start to build a set of programs that actually have been implemented in the real world and work. That is the goal of this program.
Right, and I think that I would agree with that. And this is where I probably would, I think normally I'm much more optimistic than Rob, because he's an old curmudgeon. But I do think if you recall the New York Times editorial a few days ago about what HHS has done for the teen pregnancy programs and which evidence-based programs were being removed from their list of evidence-based programs, I do worry about that. But I take your point, and I think that it's hopeful. I mean, the Chicago Cubs did win the World Series, so let's be hopeful. Yes, right here. Can you just state your name for us and where you're from?
Nicholas Zilla, Institute of Family Studies. I'd like to raise a type of prevention which has not been mentioned and which is the subject of a previous Brookings, and that has to do with unplanned pregnancies, and specifically the question, what should be done with parents who have been determined to be neglectful or abusive of children to prevent them from having future children who will enter into foster care and into the prison system. We are now extremely permissive about this. Should we be doing more to try to prevent further births to determined neglect abusive parents?
Panelists?
I'm not going to, yeah.
Should restrict them from having babies.
This is so far out of my scope, I'm not, yeah, no.
I'm trying to find a diplomatic answer to your question. So I think every person should have the right to get the family planning support and services that they want and they choose for themselves. I think the reality is, I will actually, your comment strikes a chord in me, because when I was representing kids in foster care in Chicago, I remember one of the judges said, after the parent walked out, this parent had 6 children who had all come into the system, and she said this mother also happened to have a serious drug addiction problem and underlying mental health conditions that really she was self-medicating. And she said, when are we going to just bring eugenics back and say, these mothers shouldn't have any more kids? And, it's part of the reason that I went into policy, and it's part of the reason I do the work that I do now. The reality is that these people are not any different from you or me. They all have struggles as individuals and as parents. And if we know that they have a mental health issue or a substance abuse issue, I would rather focus on giving them the medical treatment and the services and supports they need so that they can provide and care for their children as best they can.
Yes, in the back there.
Yes, good afternoon. My name is Kanika Brookings. I'm a community activist. I'm also a clinical research study freelancer. I wanted to know, in these situations when the children are in the foster care homes, I work closely with some individuals who are foster care givers. And oftentimes, like one lady in particular, she does emergency. They can call her in the middle of the night. She'll go to the hospital and pick up a child that's been literally thrown out or severely mistreated. Do we have any statistical data that shows how many of these children are mistreated or are runaways or are just thrown out like trash? And also, do we have any statistical data on the success stories of these children that have been in foster care?
Quite hear the question,
Yeah,
but
I'm
so
sorry.
I heard a piece that, forgive me if I misheard you, so I heard a piece about whether we have the numbers on how many of these children in the foster care system have actually been maltreated. That was the first piece, I think. And the second piece I didn't quite hear.
Successful.
Success stories, okay. I'll just speak briefly on the first piece. So all of the kids who end up in foster care have proceeded through these earlier stages of child welfare system and child protective services system contact. So at some point, a caseworker has investigated the allegation of maltreatment and either substantiated the maltreatment or removed the child from the home, very often because they had a sibling or another child in the house was maltreated. So that is relying on the caseworker's assessment of the maltreatment. And there is error around that. So my understanding is that if we take the caseworker's assessment as fact, then most of these children have been maltreated, but there's gray area around whether placement in the foster care system is the right response for that substantiation. I don't know if you wanted to comment further on that.
Yeah, I think Ron had on one of his earlier slides kind of the number of kids who get brought to our attention through a hotline call to any of the state or local systems. That number is up in the 5 to 6 million every year. Then there are about half of those kids who, once an investigation is done, someone says that there has in fact been some or a reason to investigate, right? The reality is that close to 1 million kids, there's some finding of abuse and neglect, and today roughly 40% of those kids receive no additional services, right? And that's primarily been driven by the fact that we didn't have funding for preventive and early intervention services. Again, we're hoping that Family First will change that dynamic. And as far as positive outcomes for young people who have experienced foster care, we work with a number of, the foundation I work for actually provides foster care for a handful of young people, often young adults, and I meet young adults every day who are incredibly strong and resilient, who have overcome incredible odds to not only graduate from high school and college, but often I think what's most impressive is that they come back into the child welfare system as professionals, as foster care workers and social workers. And so you're right to point out that it's not just a sad story, right? There are really incredibly amazing young people in the system.
I think we have time for one more. Maybe two more.
Hi, Ashley Moore. I'm a school counselor. So specifically, one of the common factors for all of these kids is that hopefully they're going to be in some sort of school or educational system wherever they are around the country. So in terms of any recommendations, either programmatic or policy-wise, specific to schools or the education system sort of at large, more at like a state level, or programs at like a local level, any thoughts on that?
Yeah, I could speak to that a little bit. At the end of the day, there's not, to my knowledge, rigorous evaluations of school-based programs that are designed to help children of incarcerated parents in particular. So I don't think we have good sort of evidence in terms of what works and what doesn't work. I do want to put a little bit of a plug, though. I was telling John about this program in LA. It started out in Venice High School. It's called POPS, Pains of the Prison System. I'm not sure if any of you have heard of it. It started at Venice High School and has sort of been kind of making its way across the country. And it's this great program where during lunch hour, kids who've been teenagers, high school students who've been affected by any sort of family member incarceration are sort of go to this space, and lunch is served, and every this happens once a week, and the students sort of they get to share poetry, they get to share journals, they get to share their thoughts about how they've been affected by the criminal justice system sort of broadly. And while there isn't any sort of evidence out there, I've been to this group a couple of times, and it's amazing, and it's done great things for these youth to really give them sort of a safe space to be able to sort of talk through their experiences. So I think things like that, and I think for school counselors and for teachers out there to sort of be aware that, as you know, students are coming to school with a lot of family complexity, whether it's incarceration or foster care or other types of family complexities. And so I think the more that there's awareness among folks who are helping these kids, and sort of awareness of the challenges and the sort of the strengths and the resilience that these kids bring, that can really be quite beneficial.
Can I just add to that, though? So I agree with everything you said, and I think the other thing that strikes me, I was thinking about this in getting ready for this talk, is we had hosted a listening session a number of years ago, our agency, around the topic of children of incarcerated parents. And one of the things that was mentioned by kids who actually came, who were, he had experienced parental incarceration, was this fear of sort of labeling, and we're looked at as it's a risk factor, and thus it's determinative, and we're going to end up in the system. And I think, and then on the flip side, we actually have a study right now we're doing with a population of kids with parents that are incarcerated, about 1,200 kids. 15% of the kids don't even know their parents in the system. So I think that we have to think about how to sort of balance that and try not to be putting kids on a path so that they feel like they're already, they've already gone down that road. And so that's why I actually thought Dr. Sampson's point about concentrating on neighborhoods is a really interesting thing, because there, it's a little less, targeted, but at the same time, like you said, you've got these neighborhoods where city blocks where you have such high rates of incarceration.
I'm afraid we're out of time, but I want to thank the panelists and thank you all for coming.
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.